Hi, my name is Dr. Tamisha Denis, and I'm going to tell you today how you can straighten your teeth in 2 weeks. I often meet patients who are considering straightening their teeth with braces or Invisalign or ClearCorrect or fast braces, and I like to offer sometimes, depending on the circumstance, an alternate option. Now, that's something we could discuss on a case-by-case basis, but sometimes people are looking for that immediate result. They don't want to wait a year and a half, 2 years, sometimes 2 or 4 years, depending on what kind of braces that they do, in order to see the straight teeth, the perfect teeth, the Hollywood teeth that they're looking for. So in that case is when we consider crowns and veneers. Now, when we think about cosmetic dentistry, most people think about veneers, but we can't take away from the fact that crowns also help to make your teeth look better. Not only do they correct the shape, not only do they correct the color, but they're also correct or appear to correct the position. Now, I have a lot of people who their back teeth are in good position. We call that good occlusion. That means when their teeth come together in the back, it's pretty good. And really what bothers them is the teeth towards the front. Now, there's a lot of different circumstances that can make us consider crowns or veneers to correct those things. But if we have a pretty good bite, and we really don't like the way the teeth look in the front, we can consider crowns, dental crowns or veneers, to create what we call instant orthodontics. That means right away things are straight. Now, the reason I say 2 weeks is because initially the first visit is to prepare the teeth. That means that we're going to shape the teeth in the position that we want. Then we'll take molds of those teeth and we send them off to the laboratory, and the laboratory will make crowns or veneers, porcelain, beautiful looking crowns, and they will send them back to us in about 2 weeks. And in those 2 weeks, we put the crowns in, and instantly your teeth look straight, look white, look pretty, all at one time. Now, the circumstance that we do that gives you instant results. We don't have to wait the 1 year, the 1 year and a half, or the 2 years in order to straighten anything. Now, in a moment, we're going to show you some circumstances that may apply to you if you're considering maybe cutting that whole straighten your teeth process short and considering dental crowns and veneers. Now, I'm going to describe about 4 situations that are probably the most common reasons that we can skip the braces and straighten our teeth in 2 weeks. Now, the first case is going to be gaps and spaces. Some people have a gap between their 2 front teeth and they don't like it. Maybe you have multiple gaps in multiple spaces that you'd like to correct or to close. Now, again, maybe you don't want to wait 2 years to close your gaps and spaces, and there are other things about your teeth you don't like. Maybe you have dark stains or big old fillings that you had before, or maybe a cracked tooth from an injury. And what we do, again, we can crown those teeth, and we really try to, and I really make a big point to discuss all the things that you don't like about your teeth ahead of time. So I'm very conscious to relay all of that information to the laboratory ahead of time. So we'll talk about the spaces, which ones you like, which ones you don't like. You'd be surprised at how many people say, Dr. Denis, can you just close my gap just a little bit and leave a little bit? Some people like that Madonna look and they want a little bit of a gap. So we can kind of pre-plan that ahead of time to say how much of a gap we're going to leave. Are we going to close it completely? And we relay all that information to the lab so that we can close your gaps and spaces. The second circumstance is crooked teeth. So if your teeth are kind of in all kinds of different positions, again, mostly towards the front, maybe crowns and veneers are the best way to go to correct that. So again, we can make it appear as if the teeth are in a new position, and that will be corrected with the crowns. We can get them all in one line to make sure the teeth look all straight. Now that's very strategic on my end, and again, I will let you know if that is something that you can consider. So we got crooked teeth all over the place and we want to make them look straight. We can put crowns and veneers to correct all those things, and you also end up with a wider smile. The third scenario we can consider is overlap teeth. I often get, and I've done many of these cases, but the two front teeth and one kind of sits on top of the other tooth. And what we can do is, in a certain way, we can shave the tooth in a particular way to make sure that the teeth look like they're side by side instead of one on top of the other. Of course, that same thing can be corrected with braces, but if there's multiple things about your teeth that you don't like, and it just happens to be that one of those things is the overlap teeth, maybe crowns or veneers can correct that, and you can have that done quite quickly. Now, number 4, in terms of correcting instantly with instant orthodontics with crowns and veneers your teeth, is dark teeth. There is no amount of straightening that can make your teeth look white. So even if your teeth are straight, but you don't like the color of your teeth, certain people, whitening works very well for them, and certain people it does not. So again, if you see the theme of all of this, we're not just talking about teeth that have a gap or space, or crooked teeth, or overlaps. We're talking about multiple issues with the teeth that maybe straightening your teeth with braces is not the best answer. Maybe doing crowns and veneers is the best answer because it will correct multiple things at the same time. So we're going to talk a little bit about what the things that crowns and veneers can do to straighten your teeth in just 2 weeks. So the 3 main things that crowns and veneers can do in just 2 weeks to make your teeth look better and straighter is, number 1, shape. So if the tooth is too little, too big, too wide, too long, we can use crowns and veneers to make them look different. We can shorten the teeth. We can make them appear more narrow. We can push them out further. It depends on the kind of cosmetic or aesthetic that you're trying to accomplish. The second thing that we can fix with crowns and veneers instantly is position. So some people, their teeth are flared out. Maybe they have a really big overbite, or maybe they're too far back, or maybe they're to the side, to the left, or to the right. We can narrow those teeth down or pull those teeth back into place to make them appear as if they are in a position that they really are not. And that's just some of the tricks in dentistry that we can do. Depending on how far back we can go, we can analyze all of those things ahead of time, but we can reduce overbite. We can make an open bite appear closed. We can make a lot of illusions to make sure your smile looks really nice. The third thing we can do is color, and color is probably one of the most important things. And the reason color is so important is, again, not everyone can whiten their teeth. Not everyone gets the results from whitening that you think. We can never promise how white your teeth can get. Some people it's like 10 shades whiter. Some people it does nothing. So you really want, if you want to stable color that will not change over time, because crowns and veneers, they do not stain, they do not change color. So even if you drink all kinds of coffee and red wine and all kinds of things that stain the teeth, typically those teeth are not going to change color. So one of the really great things about crowns and veneers that can not only improve the position and the shape of your teeth is also that it is a stable color that you don't have to worry over time. Now, most of us are not going to give up our morning cup of coffee, so that's one of those things you can feel confident that if you get crowns and veneers, that is not going to change. So shape, position, and color. Now let's look at some examples of some of the cases we've done in our office to correct some of those things for that instant result. So we're going to go through a couple of actual cases that we have done in our office at Modern Smile and Implant Center to correct certain things about people's teeth that are instantly corrected in one appointment. So obviously the first appointment we prepare the teeth, and usually well, all the time, people leave with temporary crowns that are very closely representative of what we're going to actually have the result of. Of course, the lab is going to receive the impressions, and then they're going to receive their porcelain crowns in 2 weeks. So the first case is a patient I saw, a male, in my office that had multiple large cavities on his teeth. And obviously, if you look at these photographs, the teeth are quite damaged. The cavities are very big and the teeth look very dark. Now, imagine if we just close his gaps with braces. It wouldn't correct all the color and the cavity and stuff like that. So what we did is we placed crowns on all his front teeth, and he was very happy with the result. Another case we have here is someone who had multiple bonding. So when people say bonding, it's a lot of composite material that's placed on the top of the teeth. And as I noted before, when you have porcelain, veneers, or crowns, they do not stain over time, but bonding does. And you can see at the top of the picture that the bonding has started to deteriorate, change color, cavities start to form underneath it, and underneath is the final crowns, which is a beautiful result. Then I have another patient that has a tooth that was damaged as a child, and they did a root canal but never quite crowned it, and you can see the tooth is starting to turn yellow. And what happens when the tooth turns yellow, it doesn't look very good. So what we decided to do is crown both front teeth, and now beautiful cosmetic result. Another patient we have, we tried to correct multiple bondings and fillings that had been done on her teeth for several years, and no amount of whitening was fixing it. So we decided to do dental veneers, and the picture that you're seeing is actually the picture of 2 hours later after the veneers were prepped, and these are the temporary crowns. So the permanent crowns looked even better than that. Then I had another patient. She had a birthday coming up, and she really did not want to wait for braces to correct the tooth that was overlapped on top of the other teeth. So we decided to do veneers on her front teeth, and you could see 2 hours later her teeth are straight. Her final crowns were gorgeous. And then the last case is kind of the opposite. The side tooth was behind the front tooth, and what we did is within that appointment we made everything seem corrected just by having crowns done on those teeth. And those are just the temporary crowns. Again, the final crowns were beautiful. Thank you for watching this video about how you can straighten your teeth in just 2 weeks. If you would like to see if any of these circumstances apply to you, give our office a call and we'd love to do a free consult for you. Thank you for watching.